All right, ears, nose, mouth, and throat. All right, so use the techniques of inspection and palpation to examine the ears, the nose and sinuses, the mouth and throat. Unexpected sinuses, polyps, retracted eardrum, decreased hearing acuity, otitis externa. So the following cranial nerves are for the ears, nose, mouth, and throat. Cranial nerve 1, olfactory, which is the sense of smell. Cranial nerve 7, facial. Cranial nerve 9, glossopharyngeal, assess the mouth for taste. Cranial nerve 8 is auditory, assess the ears for hearing. Remember in that face, 8 were the ears. Cranial nerve 9, glossopharyngeal, and 10, vagus nerve. Assess for the mouth for movement of the soft palate and gag reflex, also assessing for swallowing and speech. Cranial nerve 12, hypoglossal, assessing the tongue for movement and strength. So, equipment, otoscope, wristwatch, tuning fork, nasal speculum, tongue blade, pen light, gauze, and a cotton tip applicator. Alright, so do your whole PQR stage. Do you have any itching, pain, nasal sprays, breathing, difficulty, family history, all that stuff. So, ears. Expected findings would be the top of the auricles meeting an imaginary horizontal line that extends to the outer eye. Should be about equal size and level with one another. Ears should match the color of the face. No lesions, deformities, or tenderness. No foreign bodies or discharge. There might be a small amount of wax or cerumen. That's earwax. All right, the internal ear. You straighten the ear canal by pulling up and back for adults and down and back for children that are younger than 4, I believe. Using the otoscope, insert the speculum slightly down and forward, 1 to 1.5 centimeters, but not touching the ear canal, just to visualize. Tympanic membranes that are pearly gray and intact, taut and free from tears is what you want to see. A light reflex that's visible and well-defined cone shape. Ear canals are pink with some fine hairs. So some auditory screening tests. The whisper test, that is cranial nerve 8. Auditory. So we know how to do the whisper test. The client should be able to hear you softly from about 1 to 2 feet away, saying like a 2-syllable word. All right, now the Rhine test is when you place a vibrating tuning fork firmly against the mastoid bone. So it's this bone right back here. Alright, so you bang the tuning fork so it vibrates, and then you have the client state when he can no longer hear the sound. And note the length of time that the client heard the sound. That is the bone conduction. And then you can move the tuning fork in front of the ear canal. When the client can no longer hear the tuning fork sound, note that length of time the sound was heard. That is air conduction. So bone conduction on the mastoid process, air conduction when it's just next to the ear. So the air conduction versus bone conduction should be about 2-to-1 ratio. Those are those numbers. So 2-to-1 from air to bone conduction. All right. So the Weber test, that is when you take the tuning fork that's vibrating and put it on top of the client's head, kind of near the temporal bone. Ask whether the client can hear best sound in the right ear, left ear, or both. The client hears the sound equally in both ears is the expected finding, and that would be called a negative Weber test. So negative is good in this sense. All right, so moving on to the nose. So should be midline, symmetrical, same color as the face. Observe for any tenderness, swelling, masses, deviations. Each nair is patent without excessive flaring. The structure of the nose is firm and stable. To examine the internal structures, just you can insert a nasal speculum just barely into the nairs as the client tips the head back. The septum should be midline and intact. It shouldn't be like a hole through it. That could be a congeal effect, or it could be from drug use, or is congeal I'm thinking of? Congenital, whatever, once they're born with it. Alright, so mucous membranes are deep pink and moist without discharge or lesions. Then you can assess cranial nerve 1, which is smell. Ask their parent, the client, to close their eyes and occlude one nail at a time and identify a smell, a familiar smell in their nose, so maybe like vanilla, coffee, something like that. If they can't smell, it's called anosmia, and you only have to do that really for performance test wise if they say they've been having trouble smelling. Alright, so mouth and throat. The lips should be a darker pigmented skin on the face, moist, symmetric, smooth, soft, no lesions, non-tender. Gums inside, you can use your pen light. A coral pink and tight against the teeth, no bleeding from palpation. Mucous membranes, pink, moist, no lesions. Alright, so for the tongue, use a gauze pad to hold the tip and move the tongue from side to side. The dorsal surface should be pink. Presence of papilla and symmetric. The underside of the tongue is smooth with symmetric vascular pattern. You can assess taste. We're not going to do that in the performance test, but just have them choose someone. So then you can do test strength, cranial nerve 12, by applying resistance against each cheek while the client sticks the tongue into the cheek. The tongue should be midline, moist, free of lesions, and move freely. Teeth, shiny, white, and smooth. No any missing or loose teeth or discoloration. The hard palate should be whitish, intact, symmetric, firm, and concave. That's more in the front. And then posterior is a soft palate, which is a lighter pink, intact, smooth, symmetric, and moves with vocalization. The uvula is pink, midline, intact, moves with vocalization. And then you're going to grade the tonsils. So 0 is the tonsils were removed, and you would write that down. 1 is barely visible, or they cover about 0 to 25% of the mouth. 2, that's when they're like halfway to the uvula, about 25 to 50%. 3, plus 3 is they're touching the uvula. And then plus 4 is when they're pretty much midline or touching each other. 75% to 100% of closing the mouth, although it wouldn't be really 100%. Speech should be clear and articulate. So technique for sinuses. You're going to palpate the front sinuses by pressing upward with the thumbs just below the eyebrows, then on the side and the bridge of the nose. Palpate the maxillary sinus by pressing upward at the skin crevices that run from the side of the nose to the corner of the mouth. So right here. You expect them to be non-tender. So with aging, for all the symptoms that were in this chapter, eyes, it's usual, don't assume this, but decreased visual acuity, decreased peripheral vision, presbyopia, which is inability to see small objects or small print, might be decreased ability to accommodate in extreme changes of light, thin gray white ring around the cornea. They might lose the lateral portion of their eyebrows a little bit. Might have some hearing loss. That's presbycusis. Prebycusis. Presbycusis. They might have cerumen accumulated, so that's earwax, or thickening of the tympanic membrane that's inside the ear. Mouth might have a decreased sense of taste because the number of taste buds go down. Tooth loss, pale gums, gum disease, and due to any inadequate oral hygiene. They might have decreased salivation, darkening of the teeth. Their voice may rise in pitch, but loss in power and range. And their nose, they might have a decreased sense of smell. Alright, and that is eyes, ears, mouth, and throat. Alright.